Hi, and welcome back. Today I'll discuss leaky gut and the causes. Then I'll talk about 4 of the most effective strategies to eliminate symptoms, so make sure and listen until the end. Leaky gut syndrome, which may impact between 25 to 88% of individuals displaying symptoms, encompasses a range of gastrointestinal issues. Dr. Mark Hyman, a highly knowledgeable functional medicine physician who understands how problematic a leaky gut can be, describes it best.
Anybody with chronic gut issues like irritable bowel, diarrhea, constipation, bloating, inflammatory bowel disease, if you have skin issues like eczema, acne, psoriasis, for sure you have a leaky gut. It's one of the most important things to understand about your health and whether you have it or don't. And it's because it drives so many of the diseases we see today in modern civilization. So many things, from diabetes to obesity to heart disease to cancer to autoimmune disease to asthma to depression to autism to ADD. I mean, you name it, basically, it's connected to our gut and our microbiome. And most people don't really understand what that is, or what a leaky gut is, or what to do about it.
Since leaky gut could be a fundamental factor in many of these symptoms, to address this, I will introduce you to 4 highly effective methods to enhance your gut health, backed by practical, science-driven insights. This includes exploring the significance of nutrition, lifestyle, and overall gut health through research analysis, providing clear, reliable information that cuts through misinformation. To better understand, I will show you what is actually happening inside the leaky gut. There is sufficient data to affirm that increased intestinal permeability, commonly known as leaky gut, may play a role in various syndromes, symptoms, and diseases. This concept is illustrated in a diagram from the journal Frontiers in Immunology. What you're observing is the interior of the small intestine, specifically the intestinal lumen. This part of the intestine is crucial as it absorbs over 90% of the calories and nutrients that we consume. It is here that leaky gut may develop due to its role as a selectively permeable barrier which requires precise regulation. In other words, this barrier is very thin and vulnerable if not maintained. The diagram you're seeing shows how an imbalance or overgrowth of bacteria and fungi disrupting the microbial balance is one of several factors that can compromise the health of this barrier. When such disruptions occur, substances like endotoxins or LPS can leak through into the bloodstream. This leads to an immune response characterized by inflammation, which includes the release of compounds such as TNF-alpha and interleukin-6 depicted in the diagram. These substances all contribute to causing inflammation.
So what is exactly a leaky gut and what does it mean? Well, basically you've got an entire intestinal tract that has only one cell lining. In other words, only one cell between you and a sewer. So on one side is poop and food, and the other side is your bloodstream and your immune system. And if those interact, it's a problem. You want the food to go through your cells. They get filtered through the cell, not between the cells. And the broken down food components that are the basic building blocks of what you need to survive are just filtered through the cells and get into your bloodstream, and everything's hunky-dory. When those cells, that single cell lining, which basically is spread out the size of a tennis court, when it's damaged, and this like Legos stuck together, the Legos come apart. And then food and bacteria and other toxins leak in and get exposed to your immune system, which triggers an immune response.
One primary cause of leaky gut is the disruption of microbial balance, which might be referred to as dysbiosis or bacterial overgrowth, such as seen in conditions like SIBO, small intestinal bacterial overgrowth. Additionally, inflammation plays a crucial role, with markers such as C-reactive protein, TNF-alpha, and interleukin-6, among other inflammatory cytokines, contributing to and resulting from leaky gut in a complex two-way relationship with gastrointestinal disorders. Common gastrointestinal conditions like IBS, irritable bowel syndrome, IBD, inflammatory bowel disease, celiac disease, and GERD, gastroesophageal reflux disease, often signal the possibility of leaky gut. Lifestyle factors also significantly impact this condition. A Western diet, excessive alcohol consumption, poor dietary choices, inadequate sleep, and chronic stress all gradually deteriorate the health of the small intestinal barrier. Furthermore, certain medications, such as antibiotics, NSAIDs, anti-inflammatories, and even chronic use of decongestants can weaken the intestinal barrier over time. Chronic diseases and aging also contribute to its degradation, setting the stage for the development of leaky gut. Processed foods often contain additives like emulsifiers and coloring agents, which can be detrimental to gut health. A notable diagram from the 2022 issue of the journal Foods highlights several of these substances, including carboxymethylcellulose, carrageenan, glycerol monolaurate, and polysorbate. These ingredients are known to increase the risk of leaky gut and inflammatory bowel disease. While they are effective at improving food texture, appearance, and extending product shelf life, these emulsifying agents can irritate and potentially damage the gut lining. I will cover these in further detail in a future video. It's important to note that consuming processed foods occasionally is not necessarily harmful. The goal is to avoid developing an unhealthy relationship with food where processed items dominate your diet. Moderation is key. However, if processed foods are a frequent part of your meals, several times a day, it's advisable to consider making dietary changes. This is crucial because such foods can actively exacerbate issues related to leaky gut. The detailed diagram you're viewing highlights how emulsifying agents, along with other ingredients found in processed foods, irritate the gut lining, which contributes to the development of leaky gut. The key takeaway from this diagram is the detrimental impact these substances can have on intestinal health. Now, as promised, let's discuss strategies to treat leaky gut symptoms. First being to eat only whole foods. Whole foods are nutrient-dense, usually lower in calories, and less likely to lead to overeating. They provide essential phytonutrients, fiber, healthier proteins, and fats. A simple yet effective approach is to shift from a diet rich in processed foods to one that emphasizes fresh, unprocessed foods. A practical tip often mentioned is to shop the perimeter of the grocery store. This is where you'll find fresh foods that spoil, unlike the inner aisles that are stocked with longer-lasting packaged foods, often containing emulsifiers, which we discussed earlier. This approach to diet is adaptable, fitting into various dietary plans like paleo, vegan, Mediterranean, high carb, or low carb. The next strategy is to follow an elimination diet. Please note that when discussing food sensitivities, it's crucial to consider elimination and reintroduction diets. This involves initially removing common irritants like gluten, dairy, eggs, soy, fish, shellfish, nuts, and seeds from your diet. Not all of these foods cause leaky gut, but they can trigger symptoms in some people. After a period of elimination, these foods can be gradually reintroduced to determine if they cause a reaction, helping to identify specific triggers. So a good elimination diet is the low FODMAP diet. It stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. It's a mouthful, I know, but essentially, these are types of short-chain carbohydrates and sugar alcohols found in food that are poorly absorbed by the small intestine and can be fermentable by bacteria in the gut. This fermentation can lead to digestive distress in some individuals, particularly those with a leaky gut. Another aspect of this diet that often doesn't get enough attention is that despite eating healthier, consuming fewer processed foods, and more fruits and vegetables, their symptoms actually worsen. This paradoxical reaction can occur because many fruits and vegetables are high in FODMAPs and will excessively feed intestinal bacteria, leading to increased symptoms from over-fermentation. So the importance of a low FODMAP diet cannot be overstated, especially for those who find their symptoms worsen with a healthier diet. A clinical trial showed significant improvements in gut symptoms and inflammation markers after 12 weeks on a low FODMAP diet. This suggests a trial period of 3 to 4 weeks on this diet might reveal substantial benefits. Check out the link in the description for information on how to eat a low FODMAP diet. And then remember, you can begin to reintroduce the high FODMAP foods we discussed back into your diet. An essential part of a healthy diet, and our third strategy, is the inclusion of fermented foods. Historically, people who consume these foods tend to be healthier. More recently, a clinical trial involving 28 participants compared the effects of fermented foods. The results showed that those who ate fermented foods experienced a reduction in zonulin, a biomarker associated with leaky gut. The study highlighted that fermented food supplementation could improve gut barrier integrity. Therefore, incorporating foods like sauerkraut, kombucha, and kimchi into your diet might offer health advantages. Our final strategy is exercise. It has been demonstrated to help reduce leaky gut, with particularly strong evidence from a 2021 systematic review published in the Journal of Frontiers in Nutrition. This review analyzed 23 studies and concluded that exercise has a beneficial effect on gut integrity. To explain further, moderate exercise helps maintain the health of the intestinal mucosa, which, when compromised, leads to leaky gut. Additionally, exercise enhances gastric emptying and improves the movement of food through the digestive tract at an optimal pace, preventing issues like microbial overgrowth and dysbiosis. Exercise also positively impacts the gut microbiota by increasing both the diversity and the abundance of beneficial bacteria, as well as boosting the production of butyrate and short-chain fatty acids, which are crucial for gut health. For general well-being, not just for those with leaky gut, it's advisable to engage in at least 2 resistance training sessions and 2 aerobic sessions per week. These sessions, lasting between 20 to 40 minutes at moderate intensity, can significantly enhance your gut health and overall fitness. So don't feel like you have to go kill it at the gym in order to have a healthy gut. So, we found that you can stop leaky gut and its symptoms. We discussed reducing processed food intake, eating a whole foods diet, managing potential food allergens through strategic elimination and reintroduction, adhering to a low FODMAP diet where necessary, including fermented foods regularly, and getting regular exercise. Thank you for watching. If you found this video informative, don't forget to subscribe to our channel and give this video a thumbs up. And as always, stay tuned for more content on health, wellness, and scientific breakthroughs. Until next time.